Good evening. Welcome to Let's Talk Maywood on Diversity Today Media. I am your host, Dr. Reggie Ratliff. And joining me right now is my co-laborer in the vineyard, my co-facilitator, my co-host, and investment advisor, Terrence Hollisworth. Terry, are you there?
Yo, how are you?
I'm good, my man. I'm good. We have an important topic tonight we're going to discuss. And a guest that we bringing on, she is an expert in this field, as we always do. We always bring experts in the field of knowledge and discipline, and that's why we want to get the information out to our communities, right?
Yeah, absolutely. I mean, at the end of the day, we want to be good at kind of bringing people into a safe space to talk about finance and, even the community of what's going on in Maywood. How do we empower each other? And so there's a lot of Black people that are in the business that are doing good work, and we need to, provide a space for them.
Absolutely. We provide voice to the voiceless, those who are doing great things in the community, who are from Maywood or have worked in Maywood directly or indirectly. Some very powerful people. And we always try to bring good content, substance, and not just rhetoric. And certainly our guest tonight is no stranger to this podcast. She was just on last week, and we're happy to bring her back to talk about open enrollment, right? There
Absolutely.
she is.
Hey, Donna.
Ms. Donna V.
Hey, y'all.
Flesh or in the virtual space.
Absolutely.
How you doing, my sister?
Doing wonderful, doing wonderful. Thanks for the invitation to come back. Glad to be here.
Welcome back. Welcome back. I wanted to talk a little bit about tonight, open enrollment, which started rather on the 15th of this month. That runs through December 7th. From your area expertise, because you're in the field, why is open enrollment so important in our community and more so, African American community?
Well, when you look at the subject of Medicare, you're talking about people who are either disabled and not able to take care of themselves economically, or people who are senior citizens over the age of 65. So when you look at people who have health issues, people who are getting older, because a person may live a really long life and be quite healthy, but then a certain point in time can come and then they have a need for more health care services than previously. Medicare is one of those things that's in place to help people that may have that kind of Medicare healthcare need. And when you miss an opportunity like open enrollment to review your plans, to look and see what's available, then you could go a whole year without getting the kind of coverage or services that you need. And unfortunately, a lot of people end up with more serious health conditions because they haven't gotten health care at the point that they should have gotten it.
That's a great point, Donna, because I think about those who are, perhaps working full time and they have an opportunity to enroll during the open period and they don't. And then, something happened to them, like a medical issue, because they may not have health insurance. They're forced to go to the emergency room and, have this big bill waiting for them afterwards. We can really literally ill afford that type of service. So having health insurance during this open enrollment, which starts on January 1st or 2023, how does that impact them in terms of cost? Looking at from economic perspective, does it benefit them or
Well, it depends on what kind of Medicare product they have. So you have an opportunity for a Medicare supplement. Then you have the Medicare Advantage plans. So depending on what kind of plan you have can determine what your open enrollment period is. So for example, people who have a Medicare Advantage plans, those are a lot of the ones you see on TV that are zero cost and that kind of thing. That open enrollment period is really January 1st through January 31st, where a person can change Medicare Advantage plans.
Gotcha.
But if you are just turning 65, you really have a 7-month period of time. So 3 months before you turn 65, the month you turn 65, and 3 months after. And then at that point, you're looking at your annual open enrollment, which would be now.
I'm glad you mentioned that because, somebody that might be getting ready to go on turning 65, or maybe, the kids are handling the business. Explain a little bit about Medicare, because Medicare, when you turn 65, you automatically get on it, but it doesn't pay for everything, right?
Exactly. You automatically, quote unquote, automatically get Part A, which is only your hospitalization.
Mhm.
If you need doctor visits, if you need medications, that is not part of Part A. That is not Part A. That would be Part B or C, and Part C would be the Medicare Advantage plan. And along that line, one of the things that I find a lot, being a benefit counselor who works with hundreds of employees across multiple states, and a lot of people in healthcare, people think that, oh, well, I'm turning 65, I'm going on Medicare so I can drop my employer plan. You might not want to do that if you want to go see the doctor, because Part A only covers hospitalization, and that's not unlimited. So that's the thing about Medicare. Nothing with Medicare is unlimited. Original Medicare, as they call it.
Yeah. What would you suggest? Well, let me first start off by suggesting a couple of things. Is it's unfortunate that Blue Cross Blue Shield, and I'm pretty sure other companies are doing this, but they compete directly with agents, right? And so if someone's turning 65, you can sign up 6 months in front of turning 65. Well, if you're talking to an agent like Donna or me or someone else, the truth is that you're also getting stuff from, let's say, Blue Cross Blue Shield directly. Make sure, to be totally honest, that the right paperwork gets turned in, because
Mm-hmm.
even though you can sign up for directly through them, there are some things that's related to this plan when you're talking to um, an agent. The truth is that you may not need to get a supplement plan if you work for a great company that
Mm-hmm.
takes on the cost of a supplement plan, right? And so all of a sudden, your company benefits would be like, okay, you're turning 65. Now we'll take a secondary position to Medicare instead of being primary. But you don't know that if you don't do a great insurance review, you're not sitting down with a good agent, and things like that. So before we get too far, Donna, how do people get a hold of you?
So they can call me at 708-317-9233, or send an email to dwernerassociates@gmail.com. And I'd be, like I said, I work as a benefit counselor all across. Like right now, I'm in New Jersey, working
Where
with
were you yesterday?
last 3 weeks I was in Kansas City. I was in Kansas. I was in Missouri. Before that, I was in California. So I literally work with people all across the country, helping them understand their benefits, helping them make good decisions about their benefits. Because that is a key, is understanding what you have and understanding what's available for you. So in the realm of Medicare and group health insurance, group meaning through an employer, one of the things that, and this is the slight, not really off topic, but something people need to understand. One of the things that you get as a benefit if you are an employee and you are working with somebody that's offering health insurance, you're not paying the full cost of that health insurance. Your employer is bearing part of that cost.
Mm-hmm.
So, and that's one of the things people kind of misunderstand about Cobra. Anybody that's ever had to go on Cobra, they say, oh, that Cobra is real expensive.
Mm-hmm.
No, what that is you have now found out how much your employer was paying on your behalf.
Mm-hmm.
You were only
Mm-hmm.
paying a small portion. So if you can stay on those employer funded benefits, you want to do that, particularly if you have a primary care physician, which everybody should have. So you have somebody managing your care, somebody you can go to if you're not feeling well or whatever the case may be. Get that primary care physician and make sure that that physician is in whatever network you decide to choose, whether it's Medicare or an employer-based plan.
So you're doing, you're helping with people with their group benefits and employer plans and stuff. What advice do you give to people more? When you knew maybe you're just graduating college and this is your first time, getting the big packet of information about,
Right.
this is it. I just had a niece the other day said I didn't sign up for my insurance because I didn't understand it.
Exactly.
Mm-hmm.
And that is the thing, to really try to understand it and talk to somebody that is independent. And that's one of the reasons why I like what you said, Terrence, about getting with an agent, somebody that you have their number, you can call them rather than calling a customer service number like you mentioned, Blue Cross Blue Shield. Well, if you call Blue Cross Blue Shield, every time you call, you're going to get a different person. And and you may get a different answer to whatever your issue is. You want somebody you can trust, that you can build a relationship with, that can help you unravel stuff, and if stuff starts unraveling, they can be your advocate as well. So number one is understanding the plan. Number two is when you, and we can all talk about this with regard to life insurance. I have had so many people, and it seems to be so prevalent in healthcare. People work in hospital systems and in healthcare for a very long time, 20, 30, 35 years. People will work at the same hospital in the same system, but they retire at age 65 or 70 without any permanent life insurance.
Wow.
Yeah.
So the first thing a young person should do in their first job is find out where the permanent life insurance is, number one, because Terrence, just like I do, that there's some really creative things you can do with cash value life insurance, whole life insurance. Now, term is a solution, but you need to realize what term is. Term is what it is, and if you work in the right strategy, it can be beneficial for you. But in the best case scenario, the term insurance, you should need it at the end of that term, because you should have investments, you should have savings, you should have some other things in place, so you don't need to pay for your final expenses, with a life insurance policy. But if you don't have savings and you're not saving, you need to make sure you're investing in a life insurance product so that you have money in the inevitable day that you expire and you're not leaving a bill behind for your family.
So this is a very big pet peeve of mine about people selling, life insurance as investments.
I know
Right?
what you're gonna say.
Yeah, I mean, I'm from the pure investment side. So, investments are investments. Life insurance are built on a different chassis.
Mm-hmm.
Um, buying life insurance for kids. I don't know where you fit on this, Donna. And let me just say this for anybody that's watching this. The importance of advisors is that guess what, you could talk to 3 or 4 different people and they have different strategies,
Right,
and that doesn't
strategies.
mean that the strategy is wrong, but what we try to do in our master's class is to teach the principles behind it, so that whatever you decide is good for you, then that makes it good for you. So for example, when Donna talks about a person having an employer life insurance plan, but then they retire, well, what are we talking about? What we're talking about is that sometimes you're covered under a corporate plan, or you're paying very little for it. But when you leave, guess what? You are no longer covered under that plan. They're
Right,
not paying your life insurance anymore. You're
right.
without life insurance, and now how are you buried? Right?
Right.
That's what she's talking about.
Mm-hmm.
And so in that scenario, when do you buy life insurance for yourself? That's a private plan, even though you're covered by the employer plan. What
Mm-hmm.
would you say about that, Donna?
So if you are working for a kind of a major corporation, you're going to have what's called basic life insurance. And the basic life insurance is going to be something, it could be a flat dollar amount, 10, 20,000. It could be a multiple of your salary. So as you make more, they're going to pay for more, but that's only while you work for that employer. So
Mm-hmm.
so if you any of you listening, if you've ever had that kind of basic life insurance, you know that you never got a policy. You notice you never got a certificate. You notice you never got anything in the mail because you don't own that. Your employer owns that. That is tied to your position. So when you leave that position, that life insurance passes over to somebody else. And that's what ends up becoming the problem. People don't know that.
Yeah.
So then when somebody like me comes along and you're 62 years old and you've never bought life insurance before, and we talk about term versus permanent. Okay, so do you expect you're going to be living for the next 10, 20, 30 years? Well, yeah. Okay, so this is going to be one cost, but if you want to renew that plan and you're still alive 10, 20, 30 years from now, guess what? It's not going to be the same price anymore.
For the record, that policy at 60 is really expensive, and it's based on what happens when you're 60. chances are you have some
Issues.
Health
health
issues.
issues,
Right.
and so all of a sudden, they know that there's a good chance that if you're a black man, the life expectancy on a
Mm-hmm.
black man
Mm-hmm.
is 66 years old, right?
Yeah.
And that
Probably.
means
Yeah.
a policy that they may have to pay out in 6 years versus 15 years or 20
Right.
years is going to be way more expensive.
Mm-hmm.
Right.
And at the end of the day, if you think about life insurance as just mitigating risk, right?
Mm-hmm.
Their risk is that you're going to die in 6 years, and they're going to have to pay out on the policy, and they basically ain't going to make no money off of you. So
Right.
Yeah. I got a question, Donna. So is it true that employers have insurance on their employees, like life insurance, in the case they die during, their work experience while they're working? And if that's true that employers have life insurance on their employees, why would they have like $1 million life insurance policy on it?
Sure. So I have never seen in the employee and employer groups that I work with that a company has had life insurance on their um, first level, second level employees. Now you may be in a key man situation or a key person situation
Mm-hmm.
where you're the face and the character and the charisma of that particular company. Well, they may have a policy on you so that in the case that you die and you've been the person that's had all the relationships with the big donors and the big people,
Yeah.
that they need to continue that company in the transition between you passing away and whoever the next CEO is going to be.
Okay.
But that's somebody that's going to be really at that C-suite level and beyond, like an Elon Musk type of person. Whatever corporations he has, they probably have some kind of a key man policy on him, or Bill Gates, or those kind of things. But your standard thing that you're going to find is what I talked about, which is that basic life insurance, where the employer is paying for the policy, but the employee is the one that decides where the money goes when they pass away.
Okay. And the reason why I asked that question was because, there's so much information out there. I'm not sure if you heard of Michael Moore. He presented this documentary called Sicko. And in that documentary, she was a widow. She lost her husband to cancer. Then she found out that the employer had a $2 million insurance policy on her husband without her knowing. And then Michael Moore interviewed an attorney who said, that other employers have that. I don't know what his position was with the company, but based on what you're explaining, it sounded like he was like a key person within that company. So
now it could have also been a situation, because with if unless you're looking at diversity today media, you can't always trust what you see in the media.
hello.
So what I mean by that is there are also situations where people have not updated their beneficiary designations. And Mr. Sir, that was part of this documentary, he may not have updated his beneficiary designation so that his wife was the one that benefited from the policy. So in those cases, insurance companies are not just releasing money to somebody that hasn't been designated as a beneficiary. So case in point. So let's say, for example, and people that know me know that I've been married more than once.
Mm-hmm.
So let's say, for example, I had an insurance policy and I had designated a prior husband as a beneficiary and not Lee Werner, who was my current spouse. Mm-hmm. So if I pass away and that person is still on my policy and not Lee Werner, that person's going to get the money. Now, that's not Lee's problem. That's not the insurance company's problem. That's my problem because I didn't do my part in making sure that my beneficiaries were updated. So that happens, unfortunately, more than people might realize.
Word to the wise. Starting with Lee. Lee, make sure you are listed as a beneficiary. Come on, this podcast. Oh, baby. Am I good? Do it. And everybody out there, those of you who are married or as a beneficiary, make sure.
You better make sure.
Yes. We laugh, but it is a serious issue. And something else that's a serious issue is it's a fact that 1/3 of the United States population is Black or African American. We know that we are sick more often than our other our counterparts, ethnicity wise, white in particular. We come heart disease, hypertension, diabetes, things like that.
Mm-hmm.
When I think about President Obama's initiation of the Affordable Care Act that was passed, there was so much resistance from the other side of the table, specifically Republicans. They try to repeal it, and try to, it's not destroy it, but really call it back so they can make it up to the states. Without getting too political, I mean, the purpose of it primarily was for those who could not afford health insurance, life insurance, and it still exists today. Mm-hmm. And for protection and improving and strengthening those programs. From your perspective, because you're in the industry, what are your thoughts about that, the Affordable Care Act, and as far as how it's benefiting or maybe not the African American community?
Well, one of the pieces of that, one of the things that I really like about the Affordable Care Act is that because of the Affordable Care Act, if you have minimum essential coverage, it includes an annual checkup. And that's an annual checkup, physical, whatever's appropriate for your age, your gender, and AMA standards, AMA meaning American Medical Association. So if you have a minimum essential coverage, you are able to get your cholesterol tested, you're able to get a diabetes test, women can get pap smears, mammograms, colonoscopies, all those kind of things, which is amazing because one of the reasons I think that African Americans are not benefiting the way that they should is because many African Americans do not see the doctor.
Say that.
They do not have anybody managing their care. They're not getting their annual checkup. So you have to have somebody that's going to hold you accountable. Just like my doctor called me the other day to have a FaceTime with me. Now, we actually just had one a few months ago, but she wants to do it again. So I have my doctor following up with me because she cares about my health, but that's because I have a primary care physician. So as I forgot which one of you was that mentioned it, but that's why people end up in the emergency room because they're not seeing a doctor on a regular basis. And if you have a qualified minimum essential coverage plan, you can do that with no cost. So that's one of the really good things about the Affordable Care Act.
I'll tell you something that's pretty interesting. We just launched a prostate cancer study in Iowa, and a couple of things. One, prostate cancer is almost 100% curable, right? Except for Black men are dying 2 times faster than white men. And what we're uncovering in this study is that, at least here in Iowa, Black men have insurance, but we're not going to the doctor. We're not talking about the doctor, even the guys that are going to the doctor and saying that the doctor is sharing men's health with them. They just don't understand, what's going on. So when you ask them what is the test associated with the prostate cancer screening, guess what? They all have the wrong answer. They think it's a rectal exam, and it actually is a blood test, right?
There you go.
Mm-hmm. And so, these things in our communities, we have to do a lot more of education,
right.
In regards to, let's take the fear factor out. Let's take away the idea that you're going to the doctor and it's Tuskegee and they're prescribing stuff to us that they experiment on us. The truth is that a lot of these medications are not designed for Black people, right? Because in the clinical trials, when they invite us to come, we don't come. And when we don't come, they take the data and they create a medicine, but that medicine is not built for us. And then we take it, have an adverse effect, and then they make that, and they have to make an adjustment. So Affordable Care Act is I think is an important part of the conversation, but the other part is absolutely we need to have more conversations about family history and sharing that with each other and getting those early detection screenings so that we could communicate that with the doctor, because the truth
Mm-hmm.
is also is when you have family history, then insurance company might not pay for, let's say, a breast exam until you're, what, I don't know what the number is, probably 50 years old now. But if you have a family history, guess what? They'll do it at 35. They'll do it at
Sooner.
40.
Yeah.
Right. And back to one of those employee benefit type situations, one of the services that's available out there, it's a cancer screening program
Mm-hmm.
where and I won't say the name of the company, but they'll send you a kit in the mail, and you provide a saliva sample, and they'll test your specific DNA for 10 different types of cancer.
Wow.
So the early detection is key. And one of the things that the lady has said to us when she was training multiple times, and we've done this, is that because of the results that she got on this early screening test, instead of her having to wait for a mammogram, she was able to get an ultrasound, which means that they'd be able to find the information sooner.
But you can't say the company will be a violation of privacy issue or something.
Well, just because they really don't work with the individual market, it's only
Gotcha.
workplace. Yeah.
Gotcha.
So it's not. Yeah. So it's not going to help.
I was just about to say, go ahead. Let's find out what this company is and let's get to work. Right.
Right. Right.
So
Uh,
when I think about Maywood, and I think about, I was a class of '86 at Proviso East High School in Maywood. I think about how so many people from my class and younger who have passed away from breast cancer,
mhm.
prostate cancer, colon cancer, breast cancer being number one for women. It's painful because those, if you catch it early, you have a chance, right?
Right.
But because we don't go to the doctor for routine checkups or blood work, because of what you mentioned, as well as Terry, Tuskegee experiment and all that stuff happened decades ago,
Mhm.
we're always left out. And so Maywood, being that is 63% African American, 30% Hispanic, 17% white. And think about the poverty, because economics is a factor in terms of affordability. Maywood average income per household is 56,600 compared to Cook County, which is 68,000 roughly. And I think about those numbers, being an economics kind of person. Um, it takes me to the mindset.
Mhm.
Mindset saying I can't afford to buy medication. I can't afford to pay copay. I can't afford to even get to the doctor because of what's happening with inflation and that kind of thing. And I hear the conversations, but yet we're still dying. You
Mhm.
know, um, it's the mindset, right? How do we change that mindset, Donna? How do we change that mindset? Even Terry changed it. How do we change the focus, refocus, and say, hey, your life is number one. It's important.
Well, I think part of it is shifting from a mentality of health to a mentality of wellness. Because when we look at things that are considered hereditary, a lot of those things are diet
Mm,
related, because we're
mm,
we're eating the wrong stuff, we're sitting around, we're not active, we're not taking care of our physical being. And then for those of us who have a spiritual life, your
mhm.
spiritual health is also important.
Absolutely.
And people are worrying and stressed out. All those kind of things affect your body. And being in unhealthy work environments, you hate your job, and stuck in traffic every day, and you're just
Mhm,
uptight about that is not good for you, because we're not built that way. We're not built to handle all the things that we're handling.
mm,
So I think part of that is doing things that are going to allow us to live longer,
mhm,
and
mhm,
starting with, okay, let's be about wellness, not just health. Let's
mhm,
how can I move more?
mhm,
Don't call it exercise. How can I move more? How can I
mhm,
have more activity? Like one of the things I'm doing, because doing what I do, I sit most of the day.
mhm,
And thankfully, the assignment I'm on now, the people have to do a survey. So I tell them, okay, I'm gonna give you some privacy. I get up and I walk around. So every 20 to 30 minutes, I'm getting up and I'm walking around, giving them some privacy so
mhm,
they can do the survey. But then I'm also up and moving, and working
mhm.
my thigh muscles and all this kind of stuff.
Love
So if we can shift what we call things,
like that.
don't call it exercise, call it movement. Don't
Mhm,
don't call it health, call it wellness. Eat more greens that ain't cooked to pieces. Quit overcooking everything. How about that?
Yeah. Yes.
You've been looking at my diet.
Right. Yeah.
You
Woo.
so yeah.
So I
Yeah.
want to I want to ask you a question. We've been talking a lot about insurance, life insurance. Um, there's a thought out there. I don't know if you've seen this on the internet, but there's a thought out there that is all about people putting these ideas up there saying you could be your own bank using life insurance. You
Mm-hmm.
alluded
Mm-hmm.
to that.
Mm-hmm.
Kind of talk
Mm-hmm.
about that a little bit. I'm not gonna trash it too hard, but I'm gonna.
You just want to hear my perspective, huh, Terrence?
Well, I want to talk about it. I want people to understand the differences and why
Hmm.
you would do one thing versus the other, right?
Sure.
Because at
Hmm.
the end of the day, when it comes down to it, I make a statement all the time as it relates to investments, which is two people can own the same stock at the same time. One could be buying more, the other one could be selling, and they both could be right,
Hmm.
right? Investing, insurance, wealth creation, very personal from one person to the next. And so, but in order for people to really understand these things, we have to really kind of deal with it in a real transparent way.
Sure. So let's talk about something very basic with regard to life insurance. There's two basic types. And now those basic types may break down into multiple categories, but there's basic types. Term, which is temporary, and permanent. Now your permanent policies, it could be whole life, it could be universal life, could be index universal, anything that's permanent that doesn't change in cost, that has something that's called cash value. Now, one of the things that versus just being a death benefit when you pass away. So some of you have probably heard that somebody has some life insurance and they were able to borrow against it. Well, that's because they had cash value. So that cash value is it's kind of like a little pot inside the life insurance, but that pot inside the life insurance is not a dollar in and a dollar out. So it's not like a bank. You put in a dollar, you get out a dollar. But over time, after you have paid for what they call the cost of insurance, you have this little money that can be growing inside that policy. Now, with regard to the be your own bank and that kind of situation, that's because inside that policy, once you do have some cash value built up, you can put money directly to the cash value, and that will be with the conversation with either the agent or the company itself. You can put money directly into that cash value pot, and depending on where you're currently putting your money now, you could get 2, 3, 4% based on whatever the interest rate is that they're basing that life insurance cash value on. So, for those people who are just putting money in a bank, well, I think we all know that right now banks aren't giving any kind of interest like they used to be able to. And to use a life insurance product that has cash value for that purpose can be like you said, it could be a strategy that someone can use, which would cover two things at once. You have the life insurance for when you pass away, but then you have that little pot inside the life insurance itself. So that's one way to kind of think about it. And there are products that are built with a much more robust cash value accumulation than other policies. So from a lay person's perspective, it could be, and again, it could be something that could be more understandable than trying to be in the stock market where you have to understand things at a different level compared to, okay, I have life insurance, I have some extra money I can put to the cash value, and I can grow it by 2 or 3%.
So that's the part that my cousin sent me some stuff one time about a guy that was promoting, life insurance and saying you can be your own bank because you can borrow against the cash value.
Mm-hmm.
And I just want to say that at the end of the day, this part is true. If you have investments, period, you can borrow against those investments, right?
No, there you
If
Hello.
go.
you
Yeah.
if you have assets, if
If you
you own a
have.
mutual fund, big company, I mean not company, but mutual funds or individual stocks or things like this, and the rate of return on that is always going to be higher. And it's unfortunate because at the end of the day, even the universal life policies, when what they tell you, when you hear someone talk about universal life, you have the one component which is the life insurance side, and the other component is the investment side. The investment side, guess what they're going to be investing in? Mutual funds,
Mm-hmm.
right?
Yeah,
Mm-hmm.
And,
absolutely.
yeah.
Absolutely.
So, like I said, not to tear apart a person that's selling insurance. What we hope to do is to just tell you the principle behind it, and someone might be more comfortable with the money in a life insurance policy, right? And
Mhm.
somebody else might not be, but we hope that you have the information well enough that you can
Right.
make that decision on your own, kind of get to the goal that you're looking for.
Well, we want to
Right.
paint a full picture, not just half a picture.
Right.
So they know that they have options. So that's why we have these podcasts, so we can paint the full picture and have experts like Donna come on and be able to expound on what we discussed during these podcasts. And so that's what it's all about, especially for our people, because we lack knowledge, and that's why we are making poor decisions about our financials and our health. Right, Donna?
Absolutely. And like we're talking about, there are multiple perspectives, there are multiple strategies. The bottom line, have something
I know, right?
so that when you pass away, because it will happen, the
Yeah.
Bible says it's appointed to man once to die, and after that, the judgment, you will pass away.
Mhm.
So don't pretend like you're not going to. And don't leave your family a bill.
Hmm.
Leave them investments. Leave them something liquid. I had a guy tell me one time, well, my wife, she has all these properties and this and that, and she doesn't need life insurance. Well, she can't sell a property overnight, sir.
Yeah, right.
If you die today, she can't sell that property tomorrow and bury you.
Yeah.
Because guess what? Funeral homes ain't taking credit no more
Absolutely.
See,
because they've been burned so many times
Yeah.
that you better come in there with a policy or something.
Yeah.
So have an investment, have life insurance, have stocks, have something that people can liquefy to take
Mhm.
care of your final expenses.
Or
so can we go back to the Medicare piece for a minute, because there's some overlap between Medicare, life insurance, the other component, especially when we talk about old age
Mhm.
and final expenses and things like this. Before people die, generally they end up in the nursing home. Can you
Mhm.
talk a little bit about long-term care
Mhm.
insurance? What Medicare pays for. Is there a long-term care benefit that's automatically put into, let's say, a life insurance policy? And ultimately, how do people deal with going into the nursing home, their assets, and protecting them for the family?
So one of the things that is, if it's good, and that's kind of relative based on what I'm about to say, but if a person is on both Medicaid and Medicare, they're going to be in a better position to be in a skilled nursing facility or a nursing home. Now, what people don't always realize about that, so Medicaid is state aid. No matter what state you live in, they may call it something different, but that's when the state, the same people that give you food stamps, and for women that have children, and they give them a cash benefit. That's Medicaid, whatever state you live in. Uh, and then, so with that, with being on Medicaid, state aid, and Medicare, and you want or need to go into a nursing home, and you have assets, you might need to do what they call a spin down. So the extra car, the extra property, the cash in the bank, whatever
The
you
boat.
have, the boat, right, the pontoon, the vacation home, whatever you have, they're going to do a real deep dive into what you have. And for you to have Medicaid and Medicare, or want Medicaid and Medicare, to have a long-term uh, uh, residence in the nursing home, you may have to get rid of all those things if you don't already have something else put in place. So with regard to, so that's one thing. The second thing is, if you're not on Medicaid and you just have Medicare, remember I said in the beginning, Medicare does not pay for everything. That includes nursing home. So you have to have something else in place, or you will end up on Medicaid. And with that, you also reduce your options, because when you leave it to the state, and I think it's such that every nursing home or skilled nursing facility, whichever it is, I think they have so many Medicare beds, but they're limited because those are businesses.
Yeah.
So those people are looking for somebody that has a long-term care policy, like you were saying, Terrence. But these days, they have a lot of hybrid products now that include life insurance with some additional riders. That can include a terminal illness rider. It could be a living benefit rider, which means that you can use some of your life insurance proceeds for long-term care.
So let me ask you this question. So you have a life insurance policy. We're talking about a whole life policy or universal life that has cash value, right? Um, is it worth it to pay the rider for the policy for long term care, or is it more beneficial to just outright buy a long term care policy?
Well, one of the things you also want to look at is, like I said earlier, just a few minutes ago, the life insurance portion you're going to need. The long-term care, maybe not.
Mm-hmm.
So that's one thing to consider. The other part of it is when you look at those riders, the rider to add the living benefits or the long-term care accelerated death benefit and those kind of things, those are going to be a fraction of the basic life insurance plan itself. So most of that's going to be the cost of the life insurance, not the riders to add that additional protection. Now, if you have just a long-term care plan, most of those, in fact, the old school ones didn't even have a death benefit. So people were spending thousands and thousands and thousands of dollars, never going into or needing a nursing home, and didn't have a death benefit either. So that's why they restructured a lot of those plans. And not all of them are cash value policies either. Excuse me. Some of those are term. There's a company called Chubb that it's built on a term platform, but it has a long-term care rider.
Oh, I didn't know that.
Mm-hmm. They're a division of Combined Insurance.
There's been this wave for building senior communities where seniors can live independently, like in a condo or something like that.
Mm-hmm.
I mean, they're building a few out here in the Northern Virginia area. To your knowledge, is that the same situation where they have to sell their assets? Because I look at the prices of these bad fellas, and they kind of high. So I'm thinking they can, continue to work because it starts at 55 years of age and older. So does that change how Medicare and Medicaid work in terms of this new type of way of dealing with the senior population, Donna?
Well, some of those facilities aren't providing any services. They're just seniors living together, in a common community and having, different recreational events and those kind of things. But like my aunt lived in one of those facilities before she passed away, and she paid a lot of money, but it was because she had planned. She was a nurse, and she had planned for it. And her husband had passed away and left her some assets, so she had assets to be able to live in that community.
Okay.
So you're not going to find too many people Medicaid, Medicare combined. Those dual eligible people that are going to be in those kind of posh and plush surroundings. But that's why you need options.
Right.
When you in those additional things that you have, that's why you need options, because you don't want to have to spend down your money where you can't afford to live in a place like that, but then you end up in a place that you'd rather not be.
Well, I saw statistics in 2020, half of all people with Medicare lived on expenses of $29,650 or less per year and had savings of less than $73,000. The median income for African Americans was $23,000 and had lower savings rates than whites, with median savings of $14,000 compared to $117,000 for whites. So big discrepancy in terms of planning for our future, I should say.
That's the key, planning. And like you said, that's why these conversations are so important. And back, like Terry's question about, what would you tell somebody just entering the workforce? If you're going to live a long time, you need to plan and not just live for today. We need to look down the road a little bit, because down the road is coming
fast.
fast, and
Yes.
it seems to be coming faster now than it was before.
Yeah.
And for those of you who have young people in your surroundings, it's your responsibility to let them know that they should plan. Now, whether or not they listen to you, that's a whole nother matter. But
Right.
we need to train them up. We
Yeah.
need to educate them. We need to let them know the mistakes that we made, so that we can make sure that or try to attempt to put them in a situation where they're not making the same mistakes.
Train up your
So
child.
Donna, let me poke you for a minute, and I want to ask you about kid policies, right?
Mm-hmm.
When everybody gets a newborn, you start getting mailings from Gerber, just
Mm-hmm.
like when you almost get 65, you get mailings from Blue Cross Blue Shield, right?
Right.
What I'm not going to ask you whether or not you should insure a kid, right? That's another conversation. But my question is it more beneficial, do you think, to put a kid on a rider policy and you probably got to explain what a rider is, or to just set money aside for them? Because what we know is that kids generally outlast their parents.
Mm-hmm. Well, and that's an excellent question too, because I have that question and that conversation all day long. Because one of the things I'm supposed to do as a benefit counselor is to offer every benefit that's available, and it's always some form of life insurance.
Yeah.
So sometimes people, they feel real queasy about putting insurance on their children, and I position it this way: say you're not putting life insurance on your child because you think that something's going to happen to them. You're protecting their ability to get a policy in the future.
Oh man,
You're
I'm a
protecting their future insurability.
I'm gonna call you a good insurance company, but I mean agent. But usually when I say that, I go the good ones.
But I'm going to tell you a true story. So one of my friends, he wanted me to get coverage on his family. He had because his child's older, much older now. But at that point, his child was 12 years old and a type 1 diabetic.
Mm-hmm.
I talked to like 12 different insurance companies that would not insure him. Now, why would somebody think that you couldn't insure a 12-year-old child?
Mm-hmm.
Because he's a type 1 diabetic.
Mm-hmm.
So the insurance company, multiple insurance companies told me, come back to us when he turns 18.
Mm-hmm.
So they were more willing to insure an 18-year-old than a 12-year-old because he had type 1 diabetes. So that's the importance of being able to have some coverage of some sort, again, for that inevitable day, because Johnny, Susie, they're going to grow up, they're going to have a family. You don't know, maybe they have a knucklehead spouse, who knows? But a lot, you might want to protect their ability to have insurance in the future. So that's one thing. The other part of it is the rider. So having an individual policy with an individual policy number is different from having a policy and you having your child attached to you as a rider. So that's what it means to have a rider. The child is attached to your policy until they age out at a certain point. Could be 18, 23, 24, like with the Affordable Care Act, 26.
Mm-hmm.
So that means that child is attached to you. So in terms of what's good and what's bad, the budget way to do it, particularly if you have multiple children, you can attach all your children to you as a rider for a small amount of money. And then as each child ages off, then you can get that individual policy without them having to go through any kind of medical questioning.
So if they have if you put a rider on their policy, then they'll be able to convert it at 18 to their own their own individual policy
with
right?
No health questions. Yeah.
Yep.
So I want to ask you this question because it's happening. We're losing our children left and right to violence. Would that be something, because if it's a lower income area where it's high crime, would that be a barrier for them to attach their child onto the policy as far as a parent or whatever the case may be? You understand what I'm trying to ask you?
I do.
Okay.
Now, typically not, because, particularly if you're doing it through the work site. When you're doing it through the work site, they just want to know the age of your child, your birthday of your child, maybe the social, depending on the situation, because not every company wants the child's social. But they just want to know who is the person that we're covering. Now, if you're getting an individual policy, and particularly if you're going through full medical underwriting, meaning you have to see the doctor, you have to get the medical records and all those kind of things, they may scrutinize it a little bit more, and they're not going to be, so they might not necessarily be looking at your zip code.
Okay.
But they may be looking at your health history. And they may say, do you have anybody in the family that's, a parent or a sibling that's had or died of these particular conditions? So it would not necessarily where you live, but again, family history and that kind of thing.
Gotcha. Okay.
So last question I'm going to ask you is about second to die policies. Are those policies, do you like them or do you not like them? And again, you probably have to explain to the audience exactly what a second to die policy is.
Sure. So a second to die policy means if I have coverage on me and pick on my husband again. So if he and I have a policy together and we're paying on it together, if he passes away first, there's no payout until I pass away. So that's your second to die policy. I don't particularly like them because I don't know that they serve a reasonable purpose. Oh, and I just thought about something else I did want to mention. But yeah, so I'm not a fan of those type of policies. But if someone wanted one, I could certainly find a carrier that had something like that. But it's not my favorite.
Okay. Terry, you have any final questions for Donna before we end this beautiful podcast?
No, I'm glad you're on. I hope that people see where they can reach you. You should please tell them at least one more time how to get a hold of you.
Sure. So you can find me at 708-317-9233. 708-317-9233, or send me an email at dwerner, WERNER, dwerner associates, plural, at gmail.com.
And it's right on the screen in front of you, audience, so you can see it. We do want to give you a final minute or two, Donna, closing thoughts about the importance of life insurance or during this time of open enrollment, words of wisdom that you'd like to share. And by all means, go ahead.
Absolutely. So again, thank you everybody for your time and attention this evening. And as I mentioned earlier, just understand what's available for you. Ask questions. I mean, there's no such thing as a dumb question when you look at the world of financial services and insurance. The companies that I represent as a benefit counselor, they've been around for 40 plus years because people don't understand benefits. So there's no shame in not knowing. There's shame in knowing and not doing. So, just like I said, don't leave your family a bill. Put something in place, whether it's an investment, whether it's a life insurance product, whether it's term policy, do something, but do it quickly and don't pretend like the future isn't happening, because it will happen. And I'm here to help if you need me to.
Amen. We so appreciate you coming on our podcast. The Bible says that we should leave an inheritance for our children's children. That's why we have these vehicles, life insurance and investments, to know how to participate in that. But nonetheless, we are going to continue to move forward to share the knowledge and bring on experts like Mrs. Donna V. Werner to this podcast. And with that said, I am Dr. Reggie Ratliff. That concludes this podcast, Let's Talk Maywood on Diversity Today Media. Please join us for our next podcast. Open enrollment is in place today. Sign up, become part of the solution and not part of the problem. Have a blessed night, be safe, and see you next time. Peace.